Imagine getting sick in America and being more afraid of the hospital bill than the illness itself. For millions of Americans, that's not an exaggeration. It's reality. A simple ambulance ride can cost hundreds or even thousands of dollars. One emergency room visit can destroy years of savings, and even people with health insurance often end up buried in medical debt. So why does the richest country in the world have some of the most expensive healthcare costs on earth? And why are so many Americans feeling financially trapped by medical bills? In today's video, we're uncovering the truth about America's healthcare system and why this crisis affects almost every family in the country. Welcome back to the Dollar Pilot. Today, we're talking about one of the biggest financial pressures facing Americans right now, healthcare costs. And for millions of people across the United States, healthcare has become more than just a medical issue. It has become a financial survival issue. Many Americans today live with a constant fear that one accident, one emergency, or one unexpected diagnosis could completely destroy their finances. And sadly, that fear is not irrational. The United States spends more money on healthcare than almost any other country in the world. Yet despite those massive costs, millions of Americans still struggle with medical debt, expensive insurance, high prescription prices, and financial stress tied directly to healthcare. So how did America end up here? One major reason is the structure of the healthcare system itself. Unlike many countries with heavily centralized healthcare systems, America's healthcare industry is a complicated network involving private insurance companies, hospitals, pharmaceutical corporations, government programs, employers, and healthcare providers. And because so many different groups are involved financially, costs often become extremely high. Insurance is one of the biggest problems. Many Americans assume having health insurance means they are financially protected, but in reality, insurance often comes with monthly premiums, deductibles, co-pays, out-of-network charges, and surprise bills. Some people pay hundreds of dollars every month just for insurance coverage, and still owe thousands more when they actually need medical treatment. This creates enormous frustration because Americans often feel like they're paying twice. First, for insurance itself. Then again, when they actually use healthcare services. Another huge issue is prescription drug prices. Americans regularly pay significantly higher prices for medications compared to many other developed countries. Some life-saving medications can cost hundreds or even thousands of dollars every month. And many families are forced to choose between paying for medicine, groceries, rent, or other necessities. This is one reason healthcare anxiety has become deeply connected to America's cost of living crisis. Hospital pricing is another major factor. In America, medical prices are often extremely difficult to understand. The exact same procedure may cost very different amounts depending on the hospital, insurance network, state, or provider. Even basic medical services can become shockingly expensive. An ambulance ride, emergency room treatment, blood tests, x-rays, simple surgeries, overnight hospital stays. Many Americans receive medical bills they never expected. And because prices are often not transparent up front, people frequently don't know the real cost until weeks later. Medical debt has now become one of the biggest financial burdens in the country. Millions of Americans carry healthcare-related debt. Some delay treatment because they fear the financial consequences. Others avoid going to the doctor entirely unless absolutely necessary. And this creates a dangerous cycle where untreated health problems become even more serious over time. Healthcare costs also heavily affect workers. Many Americans stay in jobs they dislike simply because they need employer-sponsored health insurance. This phenomenon is sometimes called job lock. People fear losing healthcare coverage if they quit, switch careers, or start businesses. As a result, healthcare affects not only physical health, but also career decisions, financial freedom, and personal stress levels. Another hidden issue is administrative complexity. America's healthcare system involves enormous amounts of paperwork, billing systems, insurance negotiations, legal compliance, and administrative processing. Hospitals and insurance companies employ massive numbers of administrative workers. Those costs eventually get passed on to consumers. And many experts believe this complexity contributes heavily to America's unusually high healthcare spending. Now let's talk about inflation. Healthcare inflation has quietly increased costs for years. Medical equipment became more expensive. Labor shortages increased wages for healthcare workers. Prescription development costs rose. insurance premiums increased, and hospitals faced higher operating expenses after the pandemic. As a result, Americans now face rising healthcare costs. At the same time, they're already struggling with housing, groceries, debt, and overall inflation. This creates enormous financial pressure on middle-class households. Another important issue is aging demographics. America's population is getting older. As more people require long-term care, chronic disease treatment, and retirement healthcare services, healthcare demand continues rising. Programs like Medicare face growing financial pressure, and many Americans worry whether future healthcare systems will remain affordable or sustainable. Mental health is also becoming a bigger financial issue. Therapy, counseling, psychiatric care, and addiction treatment are often expensive and not always fully covered by insurance. At the same time, financial stress itself is increasing anxiety, depression, and emotional burnout across the country. This creates a cycle where financial problems and health problems feed into each other. Technology has improved healthcare dramatically in many ways. America has some of the world's most advanced medical innovation, research institutions, hospitals, and treatment options. But advanced technology often comes with extremely high costs. New treatments, surgeries, medical devices, and specialized care can be life-saving, but financially overwhelming for average families. And perhaps the biggest frustration for many Americans is this. Even people who do everything right can still struggle financially because of healthcare costs. A stable job, insurance coverage, savings, responsible budgeting. Sometimes none of it is enough when serious medical problems appear. This is why healthcare remains one of the most emotionally charged economic issues in the United States. Now here's the important question. Will healthcare costs eventually improve? The honest answer is complicated. Some reforms may help improve pricing transparency, drug negotiations, and insurance access. Technology could eventually reduce some costs. But healthcare is deeply connected to politics, corporate profits, insurance systems, demographics, labor markets, and government spending. That means meaningful change is often slow and difficult. For now, millions of Americans are trying to protect themselves financially by building emergency savings, improving insurance literacy, reducing debt, comparing medical costs more carefully, and learning how the healthcare system actually works. Because financial literacy is becoming just as important as healthcare itself. At The Dollar Pilot, we believe understanding the economy means understanding the systems quietly affecting everyday life. And healthcare is one of the biggest systems affecting Americans financially right now. The truth is, healthcare costs in America are not just about medicine. They're about debt, stress, housing, employment, retirement, mental health, and long-term financial survival. That's why so many Americans today feel both sick and financially exhausted at the same time. Stay informed, stay disciplined, and remember, understanding how money moves through the system is one of the most powerful ways to protect your future.